Hello YouTube. In this video we are going to delve into one of everyone's favorite topics, health insurance. Currently, the US is still the only Western industrial nation to not have a universal healthcare system. Some Americans actually use this as a badge of honor. People will say things like, our hospitals are better because of privatization, or America has more specialists than anywhere else in the world. These kinds of arguments are missing some very important details and are mythologizing the American healthcare system. But before I get ahead of myself, I think I should start at why health insurance and capitalism is even a theoretically bad idea. Even in theory, capitalized healthcare is a bad system. A simple but accurate description of capitalism is to make the maximum profit. How this is achieved is complex, but at the end of the day, that is the ultimate goal of every capitalist system. Those who are successful lead profitable enterprises, and those who are not profitable go out of business. This is just as true in the insurance industry, and specifically the health insurance industry. It is the goal of every health insurance company to be profitable. So, how can the health insurance company be profitable? The company will take in money from policyholders. Every person that has a policy with the company pays a fee, usually monthly, to be given health insurance. The fee is for the benefits that the company gives. The company promises to pay for some or all of the holder's healthcare costs. So the healthcare company wants to have as many policyholders as possible that use as few benefits as possible. This creates an interesting dynamic. The policyholder pays for coverage, but the company's interest is in the holder never using the coverage. This means that the company will give as few benefits as possible, yet still attracting enough holders to be profitable. Another course of action is to make the benefits as hard as possible to receive, making extra steps for the policyholder to take in order to get their benefits, or claiming that they do not qualify for some reason. In short, the insurance company will try to do anything in its power to prevent the holder from claiming their benefits. There are also many terrible real-life consequences for the absurdities of capitalized healthcare. Those who have the misfortune of having long-term illness have to face the full brunt of the system being stacked against them. They have to not only battle a disease, but also find a way to pay for their medical bills to stay afloat. I believe that the worst of all is how the system does not have any human sense of mourning. A family that loses a loved one, even a child, can still be ravaged by insanely high medical bills that do not care what tragedy has just occurred. Let's look at one specific example. A miscarriage is a great tragedy for a woman and the family, and there is no question about the most emotional devastation that the family has gone through. But that is not all. A surgery for a miscarriage can range greatly in cost from around $700 to $8,100. So a family does not only get the full emotional weight of the tragedy, but is also saddled with a huge medical bill. There's absolutely nothing redeemable about a system that puts a literal price tag on human suffering. To put a price on human life and to give a bill to a grieving loved one is inhuman. The insanity and inhumanity of the American system is clear. Everyone needs to get health insurance, but if the benefits are good, then the fee for coverage will be much higher. Low-cost insurance gives little to no practical benefit to the policyholder, but it is all they can afford. The private healthcare system is stacked in the favor of the insurance company. The only small relief for Americans are for those poor enough to receive Medicaid. So in reality, anyone with a full-time job has a hard time getting Medicaid and are tossed to the wolves of the private system. Medicaid under its current form is not a solution to the problem of health insurance in the US. So what is the possible solution to the problem? Many people will argue that America is too big or it'll cost too much for the US to have universal health care. The idea that America is too big is ludicrous. It would actually be easier for a uniform system that regulates how the same treatments and services are paid for throughout the country. As for the cost, it depends on how you look at it. If we went with a Medicare for all plan, then for most of the country, it will cost far, far less for healthcare. Instead of paying out of each paycheck for insurance, it'll be reflected in taxes. For the majority of the population, it will cost them far less. Only those in the upper levels of the tax codes will see any increase, but let's be honest, those in the top levels of the tax code will try anything to get out of paying and cry over any marginal increase, even though it barely touches their immense wealth. So, is Medicare for All the best system for universal health care in the US? It would be a simple transition for the US healthcare system. It is a system that is already in use in the country, and expanding it would be easier than creating a new system from the bottom up. This would, at a minimum, be a good step from the fully capitalist system we have today to a universal system. Over time, more European concepts can be brought into the US system. One major argument against universal healthcare is that doctors will make less and specialists would be discouraged from practicing because they have a lower salary. Germany has an answer for how to pay most doctors. Doctors who have a general practice in the US are paid per visit. If someone goes for any kind of appointment, the doctor will charge them for the visit. In Germany, doctors are paid per patients in their practice. So it does not matter if the patient visits one time or once every day, the doctor will get paid for the patient being a part of their practice. This can solve the issue of how doctors get paid. The government plan will need to pay fair market value for the doctor's practices. It will be up to smart policymaking to keep the system working and the doctors well paid for their services. Even if this works, it would not be how specialists ideally would be paid. Specialists often work in hospitals or clinics and do not have their own practices. They have fewer patients because they specialize in certain types of care. For doctors that work in hospitals, it may be wise for the hospitals to be nationalized and the government paying top salaries to the employees of the hospital. If we ever want a fair healthcare system, we must be willing to make an adequate part of the government's budget being healthcare. Without the willingness to make this a reality, we will never have a healthcare system that works for the average American. It is clear that the US has major issues with health insurance. There are many possible solutions. I'm only giving a few of them. But without a willingness to make radical changes, no system will ever work. Capitalism in healthcare will never work for the average American. Costs will continue to skyrocket, and there is nothing that the average person can do about it. Only get the government stepping in and building a new system can make a difference. We need to put pressure on politicians to take this issue seriously. Instead of focusing on social issues that are just used to divide us against ourselves, we should push our elected leaders to build a better, more equal healthcare system. A universal healthcare system will help people from all walks of life and strengthen America.